Good morning, everyone. Thank you for all coming here. This has been a great day for us as we honor all the healthcare workers here on this white Mass. I'm Paul Mathern. I'm a family physician here in town as well as a deacon, and I'm here to introduce Dr. Nick Conger. Nick is an infectious disease physician at Gulfport Memorial Hospital, and he's going to talk to us a little bit about the Catholic Medical Association.
Good morning, Bishop Kinnaman, priests, deacons, fellow healthcare workers, parishioners. And Bishop, thank you for asking me to speak today. It is an honor. So Deacon Williams and Deacon Mathern asked me to say a few words about how Catholic providers should incorporate medical ethics into their practices and to say a few words about the Catholic Medical Association. And they asked me to do it in under 10 minutes. So that's a humbling task, especially with so many amazing healthcare worker deacons we have here before us. But to begin, the Gospels are full of examples of Jesus' concern for the sick, drawing special attention to his acts of healing. These are essentially healthcare miracles. He cleansed a man with leprosy. He gave sight to the blind. He made the mute speak. He even brought a young girl back to life. I mean, wouldn't it be nice to take Jesus on rounds with us, have him in our clinics? Matthew describes how Jesus' mission fulfilled the prophecy of Isaiah, saying he took away our infirmities and bore our diseases. And so there's many different names and images we have of our Lord that help us understand all that he is. So we know the image of Christ the King, that's a triumphant image. We have the merciful image of the Sacred Heart of Jesus that shows the love of Christ pouring out from his heart. But there is another metaphor that the early church fathers had for Jesus, that of the divine physician. Jesus even referred to himself as a physician once. In Luke's gospel, he was asked, "Why do you eat and drink with the tax collectors and sinners?" And he said in reply, "Those who are healthy do not need a physician, but the sick do." But just prior to speaking those words, Jesus not only healed a man who was paralyzed, but while doing so, he forgave him of his sins. And so Jesus' healing mission went further than caring only for the physical affliction. He touched the people at the deepest level of their existence. He sought their physical, mental, and spiritual healing. We are all called to imitate Christ, and that is an area where we as Catholic healthcare professionals need to incorporate our faith into our practice by not just focusing on the physical healing, but by being more in tune with the mental and spiritual needs of our patients. Let me explain further with a brief history of medicine. It goes something like this. The chief complaint is, "Doctor, I have a headache." In 2000 BC, the answer is, "Here, eat this root." In 1000 BC, the answer is, "That root is a demon. You need a good bleeding." In 1850, the answer is, "Bleeding is dangerous. Drink this potion." In 1940, the answer is, "That potion is nothing but snake oil. Swallow this pill." In 1985, "That pill is not effective. We have these things called antibiotics." And in the present day, "That antibiotic is a government scam. Here, eat this root. It's natural." So, medicine and therapies come and go, and we do our best to apply our knowledge in order to give the best care, but the physical ailments will always keep coming. We know that death is inevitable. Therefore, attending to our patients' spiritual needs will have the longest lasting impact. In its statement to healthcare professionals, the United States Conference of Catholic Bishops say that as healthcare professionals, we pursue a specific vocation to share in carrying forth God's life-giving and healing work. Our key role as Catholic providers is to see Christian love as the animating principle of healthcare, to see healing and compassion as a continuation of Christ's mission. The statement from the UCCSB concludes, "Without the health of the spirit, high technology focused strictly on the body offers limited hope for healing of the whole person." The UCCSB further emphasized the need for Catholic healthcare workers to weave our Catholic morals and ethics into our practices, which can be increasingly difficult in our world today. We live in a time of new medical discoveries, rapid technological developments, and rapid social change. This can either be an opportunity for genuine advancement of human culture, or it can lead to policies and actions that run contrary to the true dignity of the human person. As providers, our bishops encourage us to apply our Catholic moral teaching and ethics as these new knowledge and new technologies expand. They state that each healthcare worker must form a correct conscience based on the moral norms for proper health care. And so, in addition to the guidance of the bishops, we have organizations such as the Catholic Medical Association, or the C.M.A., that can assist us as Catholic healthcare providers. The C.M.A's mission is to help its members grow in faith, maintain ethical integrity, and provide excellent health care in accordance with the teachings of the Church. Unfortunately, there are many developments in our world today that run contrary to the teachings of the Catholic Church. The C.M.A. works to protect healthcare workers from discriminatory laws, and they also seek to amplify the Catholic moral teaching on controversial issues that are in our world today, such as the increasing phenomenon of gender confusion, the expanding utilization of euthanasia offered as a cure for chronic illness, expansive use of over-the-counter medications to induce an abortion, just to name a few. But the Catholic Medical Association doesn't only utilize its resources to lobby against these efforts, but they also provide a supportive community for Catholic providers. In 2021, after 2 straight years of COVID dominating the news in our lives, one of the last things I wanted to do was to attend a national infectious disease conference. I guess you could say I was experiencing burnout. I was somehow just inspired to attend a Catholic Medical Association conference. It was so refreshing, attending a medical conference in which the talks were given through a Catholic lens. Sessions began and ended with prayer, and the sacraments were present. What was most beneficial to me was the theme of that entire meeting, which was joy. An entire meeting dedicated on reestablishing the joy of practicing medicine. And it was exactly what I needed at that time. It was both a medical conference and a spiritual retreat. It provided the nourishment I needed. C.M.A. conferences provide the opportunity for all of us to deepen our faith and network with other Catholic healthcare workers who share common values. So I looked back on the last 7 meetings just to see what I missed, because I got so much out of joy. And the themes of the last 7 meetings were service, compassion, healing, integrity, truth, and courage. And those are all virtues that I would like to further develop, and virtues that I believe that we as healthcare workers can deploy in order to facilitate the spiritual as well as the physical healing of our patients. And so to summarize briefly, since we cannot literally take Jesus with us on rounds and in our clinics, we must do so with him in our hearts, doing our best, using joy, compassion, courage, to be the best Catholic healthcare workers we can be. Catholic healthcare is a response to the challenge of Jesus to go and do likewise. Christ is the divine physician, and as St. Paul reminds us in 1 Corinthians, we are his co-workers. Thank you for letting me speak today.